Welcome to Canada's most irreverent talk show. This is the Andrew Lawton Show, brought to you by True North.
Hello and welcome to you all. This is the Andrew Lawton Show, Canada's most irreverent talk show on True North on this Thursday, July 25th, just after 1 o'clock Eastern, 10 a.m. on the West Coast, a lovely 2 p.m. in the afternoon for most of you in Atlantic Canada, 2:30 for those of you in the lovely province of Newfoundland. If you go to St. Pierre et Miquelon, I don't know if St. Pierre and Miquelon are hosting any Olympic events now that Paris is the official Olympic host, but the only thing that I have talked about on the show and will talk about as far as the Olympics are concerned, I believe, is those outfits, and we did that earlier this week. So you are Olympic free now, although I did know, just on a complete aside, there has been this brewing scandal where apparently someone who was on the Canadian soccer team in some capacity was filming the New Zealand soccer team as they were practicing, which, as I understand it, is a bit of a no-no. And then I was also reading a story this morning about, I forget the exact number, but I think it was like the 100,000 or something condoms that are going to be distributed to athletes in the Olympic Village, because apparently in the Olympic villages, there is always just copious amounts of sex going on. And all that I could think of was the problem with having sex at the Olympics that you find out after the Canadian soccer team was filming you. So take from that what you will. That's my one Olympic joke. I can't do sports humor in any other context because I don't know it well enough. But I do know a lot about politics, so we'll stick to my wheelhouse here. This morning, conservative Pierre Poilievre, leader Pierre Poilievre, was in my neck of the woods. Not for me. I just happened to be like 15 minutes away from where he was holding a press conference. So I'll share some details about that with you on this show, because I wanted to do a deeper dive into what has increasingly become one of the most galvanizing political issues that we have in the country right now, which is crime and, related to that, drugs. Now, these are technically two separate issues, but you have to view them really as one and the same, because the rise of hard drug use in communities across the country has coincided with the widespread proliferation of crime. And while, yes, organized crime, extortion, things like that cannot necessarily be directly linked to drugs in every case, oftentimes organized crime is fueled by and also fuels the drug trade. And more importantly, when you look at the property crime, theft, vandalism, so much of this is related to the rise in drugs. And it's amazing that over the last decade, we have seen a massive rise in all of these so-called harm reduction initiatives, the expansion of so-called safe supply. I put a lot of so-calleds in when I talk about drugs for obvious reasons. Pierre Poilievre this morning called someone a so-called doctor, so it's not just me. But all of these things have happened, and it's amazing the problem has gotten worse. So I think it's something that we need to unpack a little bit here. Now, we can talk about the problems with safe supply, so-called safe supply. We will discuss that in a little bit. Adam Zivo is going to be back on the show momentarily. But I also want to talk about the discussion of this, the media narrative around this, because Poilievre this morning, when he was delivering his remarks, talking about rising crime, and there were further numbers from Statistics Canada, which came out this morning, that violent crime is up 50% since 2015. There have been 572,572 incidents of violent crime in 2023, which is massive compared to the 382,000 in 2015, back when Justin Trudeau took office. But all of this is to say that we are looking at a problem that everyone in the country is seeing. Everyone in Canada is seeing it. People that live in communities across the country are seeing the drug and crime issues, but the so-called experts are the ones who aren't. So Poilievre took aim at the way that the media treats these so-called experts. This is the so-called edition of the show. It's the so-called experts, the so-called safe supply, the so-called harm reduction, all of this. But he looked at the media and said, you are part of the problem here. Take a look.
So the evidence is in, and it's final. And, I would also encourage the media to be more responsible. It is just so irresponsible for you to go and quote people who profit from the ongoing drug crisis as though they are experts. They are not experts. If they were experts, their policies, which have been implemented over the last 9 years, would not have caused 40,000 deaths, would not have seen an over 100% increase in opioid overdoses. They The last thing they want is for the crisis to end because they're making so much money off of it. We've got to stop feeding the activist class and start providing treatment and recovery. I would encourage you, if you're going to cover this drug issue, stop talking to the people who caused the problem. Start talking to the recovery centers. I would ask, why don't you ask the people when you interview them, why don't you ask them, how many people have you got off drugs? Call them up, the local public health authorities, ask them how many people they've gotten off of drugs. Because it's interesting, the media rewards these people for the carnage that they're causing. You call them experts. They're not experts. They're expert only at one thing, and that is perpetuating the drug crisis. Their policies have been implemented for the last 9 years, and we see the results. The experts are the people at places like Harvest House in Ottawa or the Oak Centre in Winnipeg, where they bring people in and get them off of drugs. Let's start quoting them as the experts. Thank you.
And of course, the criticism of the media did not stop there. Pierre Poilievre continued, and at one point, a reporter from CTV London asked him questions about this, and it led to one of those quintessential Poilievre v. reporter exchanges with this particular journalist. And the whole thing we've posted. True North has posted it on our X account and probably our YouTube page at some point today. But so the whole thing was like over 4 minutes. But I'll share with you a snippet that shows the contrast here and shows, more importantly, I think, how significant the framing is on this issue and why the euphemisms, the terms including safe supply, are inherently political, and why using these things unquestioningly actually contributes to some of the problems we're seeing in society right now, where anyone who criticizes these programs is deemed as being anti-science, when the program has really just had this delightfully euphemistic, positive-sounding name put on it that doesn't bear out with how these programs are manifesting. But this was that altercation in London this morning.
Compromise here, you've drawn quite a line this morning, but is there any compromise opportunity where you could work with some of these folks, come up with a modified plan, or is there strictly one option here in your mind?
Are you talking, on what subject? Are we talking now drugs or crime?
I'm talking safe supplies.
Well, again, how can you possibly report on the story when you're already using government propaganda? It's not safe. Yes, that's the problem. You're using the term they're using. How can you, so you've decided, you've already made up your mind, you're going to report their statements as though they're true. Well, why are you using their language?
Yeah, that's the language being used in various news conferences and other policies.
Oh, yes,
sure.
there are, of course. So you're just being force-fed talking points by the authorities who caused the problem in the first place. This is exactly the problem. This is exactly the problem. It's exactly the problem. How's it working?
I'm just asking you to answer the question of whether or not there's any room to work with these other agencies or not, or whether you're going to stick to your proposals, which are your proposals. That's all I'm asking, sir.
My proposal is recovery and treatment. Am I going to give more money to these agencies that have caused the crisis? No. They're not going to get any more money. They've caused the mayhem. Have you been around? Have you seen the tent cities?
I lived in this very neighborhood for 8 years.
Have you seen the tent cities?
Yes, I've seen it.
Okay, and you think that these agencies are doing a good job?
I think there's, sir, it's not my job to debate a federal leader on this issue, sir, but I will say that...
I'm asking you a question. You think they're doing a good job when you go to see the tent cities that are popping up everywhere in the country?
The community is doing the best job.
I agree with you on that, the community, but the agencies are different than the community. And again, you're repeating their talking points. I mean, there was a time when reporters believed their job was to hold government accountable, not regurgitate their talking points.
Who needs hard drugs when you can just watch those exchanges? Like the only drug I need is a Pierre Poilievre press conference. That's the attitude, because these things, they are so infuriating when you see stories that unquestionably hold up some people as quote unquote experts, well, denigrating anyone who has disdain for them or anyone who has a different opinion. This was the same attitude we saw during the COVID pandemic, where the government would put up certain experts who oftentimes had financial skin in the game on whatever the discussion was, or were themselves quite ideological. And all of these so-called harm reduction activists, and I'm talking, when I say all, I don't actually mean all. Let me distinguish between the few that tend to dominate the discussion. These ones are very heavily invested in this. They run programs that get a ton of money for doing this. They are ideologically motivated. They don't seem to be too motivated by the science and the data, and they don't actually have room for compromise. So even then, the question to conservative leader Pierre Poilievre, will you work with these folks? I don't think they want to work with him any more than he wants to work with them, which seems to be not that much, because they have two drastically different visions. The vision that you've seen championed by the Poilievre conservatives, by Alberta's government with Danielle Smith and Dan Williams, who's the addictions minister there, is one that says we need to get people off of drugs. And that's been what's so frustrating when you talk to or watch interviews with some people in, again, the so-called harm reduction space. They don't actually discuss getting people off of drugs. It's really about accepting that people are going to be on drugs and not being bothered by that. It's giving up on people. It is actually giving up on people, which is the least compassionate thing that you can do to those who are in a crisis, whether it's those with mental illness, whether it's those with drug addiction. It's the same mentality. I know they're different issues, but it's the same mentality as people that think assisted suicide for those with mental illness is appropriate. You are giving up on people instead of offering help. And I have spoken to people who have recovered from drug addiction. I have never once spoken to someone who regretted it. And I have spoken to people, and even this morning, I saw in my Twitter mentions or my X mentions, people who said the only reason they went to treatment was because they felt forced into it. In a couple of cases, people just told me online, and I don't know who these people are, that they had treatment that was court-ordered, and that was the only reason they did it. So it actually led me to ask Poilievre a question that I had not heard him speak on, which is whether he would take the Alberta approach, which has been proposed there. And admittedly, I think the details still need to be ironed out, and look at a national version of that. This was my question and his response.
Good morning, Andrew Lawton, True North. I know you're familiar with Alberta's approach to drugs, which similarly to you is very much against so-called safe supply. But they have proposed a forced intervention, and in some cases, really using the mechanisms of law to push drug users into treatment under certain conditions. Would you support something like that nationally?
I don't know. I need to study it more. I need to understand how it would work. I want everybody who's on drugs to be in treatment and rehab to get off drugs. What I haven't been able to figure out is, if someone doesn't want to be rehabilitated, can you require them to be? I don't know. I'd like to see some evidence for and against before I make a judgment. Tracy Gray from BC is an MP in our caucus, a common sense conservative, who's proposed that we have treatment in the prisons and that judges have the ability to make it part of a sentence that drug-related offenses have drug treatment as part of the sentence, so that the offender who perhaps they were involved in theft, but we know the theft was linked to their addiction. The judge could say, while you're in prison, you're required to be drug-free, and we're going to provide you with high-quality treatment behind bars. That makes sense to me, because they're already going to be in prison anyway. They might as well be cleaning up their body and their souls and their addictions. But I don't know if you can take someone off the street who has not committed a prison offense and successfully rehabilitate them. If we can, I'm open to it, but I need to see more evidence at this point.
By the way, I would just say, I don't know is an answer you don't hear often from politicians. And I actually respect that he was willing to work through his thought process, at least in some way publicly, which, look, I wrote a book on the guy. That's not normally how he is on these things. He likes to, deliberate internally and speak out when he has an answer. But I appreciated that. He's saying, listen, I'm open to it. I want to see the evidence. And maybe Alberta is a bit of a test case for the rest of the country in that case. But I can tell you one thing, that this is an issue that really goes across political lines. I can't remember if I mentioned it on the show before or if it was in another interview, but I was at a social gathering in some way, and I was talking to someone that was very not conservative, didn't like Danielle Smith, did not like Pierre Poilievre, did not like the Conservatives on anything. And I was like, oh, this is going to be a terribly painful dinner. And then the person volunteered, although I will say about Danielle Smith, I love what she's doing on drugs, because they realize that drugs are ravaging their communities. And you have so many people in quote unquote officialdom who are doing nothing but furthering this problem. And the news that has come out, including in London from the London police, the diversion is happening, is really just reaffirming what people paying close attention to this that aren't bound to their ideological support for these programs have known for a while. And one of those is Adam Zivo, who again was probably the least surprised by the London police announcement, because he was reporting on it before. I don't even know if it's cool now, but he was certainly reporting on it before anyone in officialdom was acknowledging the problem. He joins us on the line now, columnist for the National Post and founder and director for the Center for Responsible Drug Policies. Adam, always good to talk to you. Thanks for coming back on here. I don't know if you saw those two clips I played from Pierre Poilievre, but the one in particular I found interesting was he put aim on the media here and said the media has to stop elevating this certain class of quote unquote experts, while really ignoring that these people are so heavily invested in the status quo. I was wondering what your thought on that was.
Well, I think that's a very fair criticism. We have to I think it's pretty obvious that many journalists within Canada are not doing their job responsibly when it comes to addiction policy. So they only consult with a very small number of quote unquote experts who often don't even have a background in addiction medicine. Oftentimes they're public health experts who come from a different educational background, which is much less rigorous than addiction medicine. And they don't have a lot of clinical experience treating people who are struggling with addiction. And so this small group of ideologically minded activist scholars are cited again and again and again in most Canadian media, while addiction physicians who are actually on the ground are largely ignored. On top of that, many journalists don't really analyze their data really carefully. So what happens is that you often have them citing studies which are very low quality, and the journalists will just go and parrot the conclusion of the study, but they'll pay zero attention to the methodology. There's a great study that came out in January in the British Medical Journal that actually showed that safer supply didn't work, but that the data was reframed to imply that it did work. And there was a lot of missed media management there, which was an excellent case study of this. I'd love to talk about that later if we have the time.
Yeah, and I would say in general, there's a shortcoming in a lot of science and health journalism in that you have people that are not science and health experts. And again, one of the things that's great about journalism is that you can develop a proficiency and a knowledge of something without having gone to 12 years of school. But it means in a lot of ways you're beholden to the data you take in. And if you're getting in bad data or bad insights, or you're getting expert opinions that themselves are co-opted in some way or very heavily biased, the output is going to be that way as well. And the reporter may not even know that.
Well, that's the thing. And then the problem here is that also many journalists don't have enough time or resources to properly evaluate these studies that are presented to them. So I'm going to use the BMJ article that I mentioned earlier as a case study. So that study followed around 4,800 drug users in British Columbia over 18 months. And they claimed that safer supply patients had a 55 to 91% reduction in mortality the week after accessing safer supply. So they claimed that safer supply was remarkably effective at saving lives. But then I contacted 7 physicians and a statistician, and we spent about 3 weeks analyzing this study, and we realized that it was junk science, that the underlying data actually showed no statistically significant reduction in mortality, but that the researchers had relied on 1 week outcomes instead of 1 year outcomes, and it failed to fully filter out confounding variables to inflate the positive effects of safer supply. And that kind of work takes a lot of time, but many journalists, they don't want to do that. So all they'll do is just parrot what's in the conclusions, which is unfortunate. And even though my analysis has come out, many journalists just continue to cite that study uncritically, which suggests that they're not even interested in understanding the methodological flaws of harm reduction. It's concerning, the amount of laziness and willful blindness we see in this space.
I think that people like Sharon Koivu, who I know you and I, well, you were alongside her on a panel I had on the show a while ago. She's probably one of the most effective commentators because she does not have skin in the game in any other sense than she is a healthcare practitioner. And I think her testimony has always been valuable because she was a big supporter of these policies and just did what scientists and researchers are supposed to do, which is realize this isn't working, it's making problems worse, and then she's backed away. Because I do think Poilievre's criticism of experts that have skin in the game is incredibly valid. I mean, there people don't realize, and I was hoping you could shine some light on this, how much money there is being made by the status quo.
Well, I mean, we have to keep in mind that safer supply is very profitable for certain doctors and certain pharmacies. If you're coming in to get your safer supply drugs every single day, then the pharmacy is charging the government a dispensing fee every single day. And I've spoken to a few physicians who have crunched the numbers, and they've discovered that one pharmacy with 100 or more safer supply patients can make $1 million to $1.5 million off of that. Right. And
off of that alone. So that's nothing to do with, giving people Viagra or beta blockers or anything else. That's just on the safe supply.
Yeah. And this, of course, creates pernicious financial incentives to keep people on safer supply rather than to get them on addiction medications that stabilize them and lead them to visit pharmacies less often. For example, Sublocade is a monthly injectable quasi-vaccine, essentially, for drug use. It's essentially it's like a methadone. Well, it's like Suboxone, but then it just dissolves in your body over the course of a month. So, if you're on Sublocade, you're there for, you come to your doctor once a month, you come to your pharmacy once a month. There's much less money to be made off of you. And of course, many pharmacies are reluctant to support it because they can't profit off of it. It is concerning that some pharmaceutical interests are very invested in propagating safer supply. I know that Shoppers Drug Mart provided about $2 million, if I recall correctly, to the British Columbia Centre on Substance Use to help fund training on safer supply. So you have this big corporate interest, providing financing to an ostensibly independent research body to support safer supply that happens to be profitable for that corporation.
Yeah, and I think that when we look at this, I mean, to be honest, that should be treated with the same level of skepticism that people, should treat harm reduction research done by tobacco companies on vaping. I mean, you have to look at where this research is being funded. And I would ask you about the other side of this, which is that no one seems to be talking now in these halls of officialdom, which is the term I've been using on this episode, about getting people off of drugs. And, I remember about a decade ago when I first started to see the harm reduction discussion in London and even elsewhere ramp up, there was always that promise that, okay, and once we get people into the system, we can then look at getting them off of drugs. And I just don't hear that conversation at all taking place. And I certainly don't see any data to support that any of these mechanisms are getting people off of drugs. Do you?
No, and here's the underlying problem. So many of the policymakers and public health experts who are in control of addiction policymaking in Canada are beholden to radical drug activists who are often in active addiction. So in Vancouver, the Vancouver Area Network of Drug Users, VANDU, is highly influential and has close relationships with a number of really prominent policymakers. So if you as a policymaker are listening to people who are actively using drugs under the auspices of, listening to people with lived experience or living experience, then maybe you're not going to prioritize getting people off of drugs because the people who you are listening to are using. They want to keep on using. They conceptualize their drug use as a human right. It's interesting. I was talking to a British reporter, or rather photojournalist, who did that big piece in the Telegraph recently about Vancouver, and he was expressing shock to me because when he spoke with VANDU and when he spoke with harm reduction activists about a month or two ago, they told him that they didn't feel like there was any problem with addiction. They said it was oppressive to expect people to live fulfilling lives, or at least that's what he told me.
So how do we reorient this? Because obviously, some of the proposals on the table from the Conservatives are ending funding for so-called safe supply programs. That doesn't outlaw these programs. Provinces could still step up. I mean, theoretically, community organizations could. I don't know if they will, because I think there really does need to be a government gravy train keeping this alive. But one attitude that we've seen in Alberta is really even putting forced intervention on the table. And I think we need to see a little bit more about what that would look like. And Poilievre this morning said he'd be open to that nationally, but hasn't yet committed to it. But what other resources are available to deal with this?
Well, I think on the surface level, we should be investing far more heavily into recovery. If someone wants rehab, if they want detox, that should be available to them right away, and it should be free. And it takes several tries for someone to get off of drugs, right? So, like, if it's expensive, if it takes forever, if it takes a month to get into a program, that's not going to happen. So, at the surface level, that's what needs to be fixed. But on the more foundational level, we need to think about reforms for education and reforms in our bureaucracy. Our public health bureaucracy is a cesspool of radical ideology. In Ontario, I know that public health bureaucrats are very much pushing for these radical policies against the will of the provincial governments. And if you change government, that's not going to be fixed. And those policymakers are coming from schools that are, once again, highly ideological. So if you have graduate programs that aren't committed to evidence-based policymaking, that think that drug prohibition is just structural racism, and then that filters into the bureaucracy, we have a problem. So it's going to take a long time to shift our underlying political, or I guess governmental understructure, which leads to these disastrous addiction policies.
Yeah, before I let you go, I wanted to ask you about that, because you had a piece in the Hub to that effect, that to Bonnie Henry, who's the chief public health czar in British Columbia, criminalizing drugs is white supremacy.
Yeah, I mean, that is the most profoundly stupid thing I've ever heard. So, look, you can argue that individual laws in certain contexts may have racist intentions or outcomes. That's fair. Laws are just a tool that we use to order society, and any tool can be abused. But they were arguing that drug prohibition in general is rooted in white supremacy. And anyone with even a cursory understanding of history, let alone the current global landscape, can see that that's ridiculous. I mean, we have Sharia law, which is banned the consumption of mind-altering substances since the 7th century. So, if Islamic scholars and lawmakers from the very beginning supported prohibition, how do you attribute that to white supremacy? China in the 19th century advocated strongly for prohibition because opium was destroying its citizens. And then, of course, the British came in and forced China to end prohibition with its warships. So by the harm reduction anti-racist framework, you can basically argue that the British sent their anti-racist warships to decolonize China's drug policies. It's absurd. And even today, racial minority communities tend to hate this kind of stuff. They hate drug liberalization. In Vancouver and in San Francisco, Asian communities are the ones that want change, that want prohibition. Across the world today, East Asian and Middle Eastern countries are the ones that most strongly ban drugs. And now we have some, let's be honest, upper middle class, white progressive bureaucrats saying, actually, this is racist. You should probably listen to racialized communities if you're going to claim to be an anti-racist.
Yeah, I remember when that one white protester was yelling at a guy from Hong Kong to go home at a city council meeting in, I think it was Vancouver or whatever, a couple of weeks back. But it's exactly the point here. Adam Zivo, always good to talk to you, sir. Thanks for coming on today.
Thanks for having me on again.
All right. Thank you. You're welcome anytime. And I will say also that you can't unpack this from the crime issue. So when you're seeing rising crime, rising drug uses, this is absolutely related. And we'll talk about healthcare too in a broader sense in this episode. And it actually timed in quite well because our good friends at secondstreet.org have a new documentary out saying we need to have a wholesale national conversation about healthcare reform. The documentary is called Health Reform Now. Let's take a look at the trailer here if we can.
Poured out very recently, citing that Canada's the second best healthcare system in the world.
We begin tonight with the agonizing pain patients are facing.
I've seen wait times lead directly to people dying, including children.
She has lost 2 daughters due to long wait times in the healthcare system.
When you have elective surgery, they elect to stall you off as long as they possibly can. What kind of a healthcare system is that?
I already waited 7 years. Can you imagine 2 more just to see the specialist?
So the last thing the chief financial officer of a hospital wants is patients.
Is it normal to see so much patient suffering in a developed country like Canada?
The documentary just out, available at healthreformnow.ca, produced by secondstreet.org, whose president, Colin Craig, joins us now. Good to talk to you, Colin. Thanks for coming back on. Congratulations on the launch.
Well, thank you, Andrew. It's always enjoy chatting with you.
Well, reform is one of these tricky words because it can mean anything and nothing depending on who says it. And, there are many ways you could reform the system, some for the better, some for the worse. What is it that this film is trying to tell people?
Well, anyone who follows healthcare debate in this country knows that Canadians love the idea of having a universal healthcare system. The problem, of course, is that it's not working. We spend a lot of money. We're one of the highest spenders in the world. We have a lot of good people working in the system too. The problem is the structure of the system is broken. It's not conducive to getting good results for patients on a consistent basis. And, certainly some people have good experiences with the healthcare system. That's wonderful. But the problem is too many patients are falling between the cracks. And so really what we do in the documentary is we look at other better performing universal healthcare systems, particularly in Europe, and we examine 5 policies that are in place in those types of countries so that you ultimately would see better policies here in Canada. So basically we can copy what people are doing much better than us, and then we can bring those good results to Canada.
One of the big challenges we see in this country is that people cling to this idea of the healthcare system being something that it really isn't. And I'll say perfectly candidly that the utopian version of the healthcare system is fantastic. It's something that's free. Anyone can access it. No matter where you are in the country, you can go and get it. But if you scratch even just a tiny little bit below the surface, that's not the experience that Canadians have with the system. And look, I have had many run-ins with the healthcare system. Whenever I have needed emergency treatment, I have zero complaints whatsoever. I've been able to get it. The issue is not with emergencies. The issue is with these things that are very pressing for people, but might not rise to the level of, your organs are falling out all over the floor. And that category, the stats are just horrendous.
Mm-hmm. Yeah, and Jerry alluded to this, as you would have seen in the trailer just now, that when you have elective cases in particular, they elect to make you wait because they can. And it's not right. There's so many people that are suffering because of this. People that are literally stuck in their apartments dealing with chronic pain. It's brutal. Grandmas and grandpas that can't pick up their grandkids or babysit them or be part of their lives because they can't keep up with them. And if the grandkids crawl on them, then it causes too much pain. Just horrible stories like that. People walking around with cloudy vision while they wait for cataract surgery. We've actually heard, some bad cases in emergency rooms too, where, in one case in Winnipeg, they reported that the situation was so bad earlier this year that they had to double bunk 2 patients on a single stretcher in the hospital. Like it's gotten to a point where it's really, really unacceptable in this country. And I think some people have become a little bit numb to just assuming, well, this is how it is, or we have the US system. And what we talk about in the documentary is that, no, that doesn't have to be the choice. Let's look to Europe. Let's look to Australia and other developed nations that have better performing universal healthcare systems. Because if we copy what they do, we can ease patient suffering so that people aren't measuring their wait times in years and maybe get back to weeks, which is where it should be in a developed country such as ours.
In the Shaoli case in Quebec, which was one of the most frustrating examples of our legal system at work, because this was the case where the Supreme Court basically ruled that access to a waiting list is not access to healthcare, which is a crucial ruling. But they basically found the exact opposite in another case that has basically found that you only have a right to alternatives in Quebec and nowhere else in the country. So we can talk about the legal aspect there, but that fundamental point there that came out of that case, that access to a waiting list is not access to healthcare, that seems to be the missing recognition by the government across the country, is it not?
Yeah, it is. You're not providing health care if someone's on a waiting list for a year or two and they're dealing with chronic pain and they're getting addicted to painkillers and all the horrible side effects that I just talked about. Mm-hmm. It's not ethical, but for some reason we've just allowed that to continue. And, I think political parties of all stripes have largely been guilty for 30 years of throwing money at the problem and hoping it would go away, because they haven't been prepared to have that conversation with Canadians about reform. It is a delicate issue, but public opinion is in favor of reform. People, I think, have watched this story play out. They're saying it's not working. This approach where we throw money at the system, it's not working. We spend a lot. We're not getting the results we need. So the public is actually on side with reform. We haven't seen enough political parties and politicians sort of run with it now and say, okay, here's what we're going to do. We're going to try out some new things like that have been effective in other countries in Europe and Australia and other countries. And that's, I think, the stage where we need to be. We're seeing a bit of that. There's some positive signs in this country where we're seeing some reform measures happen, but it's not quick enough. And until we start to see a greater push in that direction, we're going to continue to see people suffering in the healthcare system.
So when you say, Colin, that the public is on board with reform, that in a lot of ways flies in the face of what the conventional understanding is, which is that this is a political third rail. And I think we see bits of this anecdotally. Anytime a politician has even so much as hinted at the idea of private delivery, you get this just absolute, holy hellfire from Liberal and New Democrat parties and some activist groups talking about switching to some, pay-to-play healthcare system. And so are you saying that those attacks are not representative of where Canadians are? Because I would have actually thought it would go the other way. The Canadians really are uncomfortable with the idea of a change, even if they don't love how things are.
Yeah, so we've done a lot of polling on this. It's all on our website if anyone wants to see it, secondstreet.org. The public overwhelmingly supports what we're seeing in different parts of the country, where the government will contract with a nonprofit clinic or a private clinic and pay them to provide care to treatment to patients in the public system. The public supports that. John or Joe patient doesn't care who is flicking the switch of the x-ray machine. They don't care if it's a government employee or a private sector employee, or if they're unionized or non-unionized, or if they have black hair or brown hair or whatever. They don't care about any of that. They just care that they get the quality treatment. They also don't want to pay for it directly with the bill when they walk out. Of course, everything is paid for with the taxes. And so that's what we're seeing in provinces like Ontario, where the government is now partnering more with private clinics and nonprofit clinics to provide those services to the public. And the public overwhelmingly is supportive of doing that if it can be done in a cost-effective way and help more patients. The public is on side with that. You mentioned the Chow Lee decision. The public is overwhelmingly on side. It's in the 60s, 70% range. When you ask the question, should we keep the public healthcare system, but allow people to pay for private options if they don't want to use the public system? The public overwhelmingly supports that. There's other policies that we talk about in the documentary that the public is on board with. What you see in Europe, where a patient in one EU country can go to another EU country, pay for treatment, and then get reimbursed by their home country. This is how you can avoid long wait times at home. If you happen to be facing one in Europe, you can go to all these other countries in the EU. Suddenly you've got hundreds, if not thousands, of options for care instead of just relying on what is available locally. The public loves this idea of bringing that policy to Canada. So you could maybe go to another province and pay for treatment, or south of the border, or to maybe you go over to Europe, whatever. So the public is definitely there and ready for health reform, but we're not seeing the political class move quickly enough to recognize that with promises in terms of decisions.
Yeah, I mean, I'll be the first to say the United States healthcare system has a lot of flaws, and most people that have the discussion you and I are having right now are not saying we should replace our system with the U.S. when there are so many better examples around the world. But when I cross the border, at Port Huron, an hour from where I live in Michigan, and you see the billboards on the interstate advertising, MRIs and X-rays to Canadians, you know that something is not working in Canada. Otherwise, there would not be this booming marketing industry in border communities to provide healthcare services to Canadians.
Yeah, exactly. Yeah, hundreds of thousands of Canadians every year get into their cars and drive to the U.S. They get into airplanes and they go to the U.S. or other countries for healthcare. I mean, we've talked to patients that have gone over to I think it was Lithuania, Germany, Mexico, the United States, China, Thailand, you name it. Canadians are going all over the world to get the treatment.
All right. Well, people can check out this issue in far more detail at healthreformnow.ca. The documentary produced by our friends at secondstreet.org is Health Reform Now. Colin Craig, always good to talk to you. Thanks for coming on today.
Thanks for the chat today, Andrew. Appreciate it.
All right. Appreciate it. Best of luck with that. We will talk to you all next week with more of Canada's most irreverent talk show. I will be back in the driver's seat for Off the Record, though, which comes out tomorrow on True North. If you want to go even just a slight notch more irreverent than we are on this show, depending on who's on. Actually, I don't even know who I'm on with this week, so it may or may not be. It'll be more irreverent. I'll make sure to bring something to you. But anyway, that does it for us for today. We will talk to you on Monday, folks. Thank you. God bless, and good day to you all.
Thanks for listening to The Andrew Lawton Show. Support the program by donating to True North at www.tnc.news.